Okay, so get this, right? Imagine, you know how a baby's hip joint ideally should be like this perfectly fitted puzzle piece.
Right.
We're diving into what happens when those pieces don't quite click together the way they should. We're talking developmental dysplasia of the hip, DDH, and you've given us like a whole stack of medical research on it.
Yeah.
And what's fascinating here is how much emphasis is placed on catching it early.
Yeah, absolutely. Those first few months of life are really crucial. DDH, it basically means the ball and socket joint of the hip, it doesn't form as it should. And that can lead to, much bigger problems walking, moving later on if it's not addressed early.
It's like those early warning systems you see on, say, a spaceship in a movie.
Right.
Like a tiny, tiny flicker now could mean total disaster later, so you have to pay attention.
Absolutely. You have to be vigilant.
And that's where these sources, they get really interesting, like right out of a detective novel. Doctors have these tests, the Ortolani and Barlow tests, where they're gently manipulating the baby's legs to feel for any signs of the hip joint slipping in or out of place.
Right.
And what surprised me was they actually listen for a click.
Yeah.
Like an audible click when they do these tests. Who knew?
Yeah, it's remarkable, isn't it? It highlights just how finely tuned these diagnostic methods are. Although it's not just about a single click. The papers also mentioned that asymmetrical skin folds, where the folds around the thighs don't quite match up, that can also be a red flag.
So asymmetry in the skin folds, it's like your body's own way of trying to tell you something's not quite right. So let's say those early examinations point toward DDH. What happens next?
Well, thankfully for these little ones, there's a whole range of treatment options,
Yeah.
Each with its own strengths. You got the Pavlik harness, the Frejka pillow, the polytropylene abduction splint, and the plaster hip spica.
That's quite a toolkit.
It is quite a toolkit.
And I have to say, I mean, the Pavlik harness seems like the real all-rounder in those early months. It's designed to, gently guide the hip joint into the correct position while still allowing for some movement. And one of the sources even had this case study where a baby with a severe form of DDH made remarkable progress using the Pavlik harness alone, avoided the need for surgery later on. It just goes to show how effective that early intervention can be.
Absolutely. Early intervention is key.
And as those babies grow, so too does the complexity of both the signs of DDH and the potential treatments.
Right.
Speaking of which, we should probably move on to those slightly older patients in our next segment because it gets pretty interesting. It's like all those developmental milestones, right, that you track as a parent. That first smile, first roll, first steps, each one kind of tells you something about how your baby is growing.
Yeah.
But what's really fascinating is how those milestones, or even the lack thereof, can also be these key indicators of DDH in these older babies, say between 3 and 18 months old.
Absolutely. As babies grow, their range of motion should be increasing.
Yeah.
So any limitations in that movement, particularly around the hip joint, can be a major red flag.
Yeah.
We're not just talking about a click or an asymmetrical skin fold anymore.
Right.
It's about observing how the baby moves overall. Things like, rolling, crawling, pulling themselves up.
Yeah.
Even how they're sitting.
And get this, the sources highlight this visual cue called the Galeazzi sign, which I found fascinating because even I, as a non-medical person, I'm like, okay, I can understand this.
Right.
Imagine a doctor is examining a baby lying down with their hips and knees bent.
Yeah.
Now with Galeazzi's sign, the knee on the affected side will appear lower than the other.
Right.
And this happens because the thigh bone isn't sitting in the hip socket correctly.
Exactly. It's amazing what doctors can spot just by looking.
Yeah.
It really shows how important a thorough physical exam is, especially at this age where babies can't exactly tell you what's bothering them, but that complexity also extends to the treatment options as well.
So it's like laying the groundwork, setting the stage for the best possible outcome.
Exactly. And speaking of orthoses, this is where that A-frame we mentioned earlier comes into play.
The one that sounds like it belongs on a construction site? What makes it so well suited for this age group?
Well, imagine it this way. The A-frame, it's all about stability and support. It keeps the hips abducted, essentially meaning spread apart, in a position that encourages proper joint development. Think of it like giving those hip sockets the best possible chance to form correctly.
Ah, so it's like giving those little hips a gentle but firm nudge in the right direction?
Precisely. But as we'll see, when we delve into the world of toddlers and beyond, sometimes a gentle nudge isn't enough.
It's almost like each stage of development brings like its own set of clues, right? You've got those early clicks and folds, then the way a baby moves, and now with toddlers, it can be something as seemingly simple as a limp.
Right, and it's easy to just dismiss a little limp in a toddler as, just part of them finding their feet. But these sources point out it can actually be a red flag for DDH in this age group.
Yeah.
That's where the Trendelenburg sign comes in.
Yeah, Trendelenburg's. Okay, that's a new one for me. What is that?
So it's another visual cue doctors look for, but this time it's about how the pelvis moves when the child walks.
Okay.
So imagine this. The child takes a step, putting weight on the affected leg. As they do, their pelvis dips down on that side.
So it's like a seesaw effect.
Exactly.
With the pelvis like dipping lower on that weaker side.
Oh, exactly. And the sources explain this happens because the muscles around the hip joint are working overtime to compensate for that instability.
Wow.
And sadly, by this stage, those less invasive treatments we talked about, like the harnesses and orthoses, they often aren't enough to fully correct the problem at this point.
This is where it gets a bit more serious then.
Unfortunately, yes. For many toddlers diagnosed with DDH at this stage, surgery becomes the primary treatment option.
Right.
We're talking more complex procedures, designed to reconstruct that hip joint, ensure proper alignment and stability. It's a real reminder of just how crucial early detection is in preventing these more invasive interventions later down the line.
Wow. We've gone from those initial subtle signs in newborns all the way to like complex surgical procedures.
We have.
It's incredible how much ground these sources cover.
It really is. It highlights the incredible progress that's been made in understanding and treating this condition.
What's really striking to me is, how important it is for parents and caregivers to be informed and proactive.
Absolutely.
Like if you notice anything unusual about your child's hip movement development at any age, don't hesitate to reach out to your healthcare provider.
Couldn't agree more. Early intervention can make all the difference. It really can.
We've unpacked so much about the medical side of DDH today, the tests, treatments, and different stages of development.
Oh, yeah.
But one thing these sources haven't really touched on is the emotional impact on families kind of navigating this diagnosis.
Right.
I imagine it's a journey filled with, worry, uncertainty, maybe even guilt, but also, hope and relief when interventions are successful.
Absolutely. It's a very personal journey.
Yeah.
And it's something that deserves attention and support.
Absolutely. The science is fascinating, but at the end of the day, it's about real people facing, very real challenges. So there you have it, a deep dive into the world of developmental dysplasia of the hip, from those first subtle clicks to the incredible interventions available today. Remember, knowledge is power, and when it comes to our children's health, it's a power worth having. Until next time, keep those brains curious and those questions coming.